Everybody like to stand. We'll do the flag salute. I know we got Marisa out here somewhere. Marisa, would you like to lead us in the flag salute?
Sure. Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Say hi to your friends and neighbors, and handshake or air shake or fist bump, whatever you're comfortable with. Hi to everybody on Zoom there. How you all doing up there? Everybody notice Raymond Erickson King here, the little leprechaun. Love it. Well, happy Thanksgiving. Happy St. Patrick's Day. I don't know why I was thinking of Thanksgiving. The year went by. Happy St. Patrick's Day. Let's see here. Again, how about visiting Rotarians? We got any visiting Rotarians in the room? Right here, Dr. Lesley Ogden. So welcome. How about on Zoom? I think I see one up there. I see Ken's got his hand up. Ken, welcome.
I am visiting from Phoenix today.
Phoenix, how's the weather down there?
It's hot and dry.
Wonderful. Wouldn't have it any other way. Any others up there? Okay, how about guests in the room here? Guests in the room. Back here at the back table.
Got my boy Jay Tucker home for a little bit from Northern Arizona.
Wonderful. Any others here? Any here? All right, back around this table.
I have our students of the month, Dawn and Carter.
Welcome. Back there, how about on Zoom? I think I see one on Zoom, maybe. Anybody up there? Any guests on Zoom? See Christy Klein, welcome. Pretty good. Good group here, both Zoom and in the room. So great job. I wanted to share a couple of little fun antics about Thanksgiving. Happy St. Patrick's Day, whatever the blunder there is. So this is a quick poem, blessing, whatever you want to call it. It's not religious, but I've changed it up a little bit, and we'll see if you catch it. So, a leprechaun is small and green. She hides where she cannot be seen. But if you catch her on this day, she must give her gold away. So as the transition to try and include diversity, we've switched that up just a little bit there. A couple other things here. So good friends are like four-leaf clovers. They're hard to find, but they're lucky to have. Unless you're in Rotary, they're all good friends. They're all lucky to have. A couple antics about St. Patrick's Day is, and I noticed Al's shirt here. He knows the original color. The original color was actually blue. It was not green. And so it's become quite a thing, and I think it was a little bit of a marketing ploy by Americans to create that green, to create that, and to have that excitement. Because again, all the things back in the day were blue, and you know, then now they turn the rivers green. I saw that the other day. They were doing the Chicago, or the river in the Chicago, and a couple of those, and spraying that stuff out. I wonder how those fish are like that. If that's good or not, I'm not sure. Again, they say if you don't wear green, you're going to get pinched. Anybody know what that's from or why that is? Anybody on Zoom know the story behind that? So they say that if you're wearing green, you become invisible to the little leprechauns. And if you find them, then again, they must give up their gold. So it's certainly an advantageous thing to do, is wear green to become invisible to them. And if not, they're going to come up and pinch you on the backside or wherever. Again, certainly marketing and U.S. traditions have really created that, and then Ireland being so green and called the Isle of Green. There's a lot of things over there. The flag has green in the color, and so there's a lot of things, and they were easy to, you know, if they can promote that and sell a few beers, I think they'll go along with about anything. Recent study shows that in 56 of Americans plan on celebrating today. I know I heard at our table we're talking about one thing or another, and probably at any restaurant in town today, you could probably order some good corned beef and have some good soda bread and those kinds of things. Other 80% plan on wearing green for the day, so I've got mine on. Who doesn't have green on it, with the exception of Al? We know it. So right back there. So Julia. Oh, I was going to send someone to pinch you. Okay. All right. Good enough. And then 90% of people claim to be Irish today. So I am Irish, so I don't have to false claim. So on that. So. Well, a couple of other things that we want to next do is we have a Paul Harris acknowledgement. So again, anytime we get these, that means that an individual has contributed to the next level. And so we certainly, this is really a recognition. It's a pin. This particular one has 4 blue jewels on it. And so that's a Paul Harris +4. So this individual has gone through our ranks and continues to support and be a vital part of our club. This individual, shows up day in and day out. So I'd certainly like to welcome Freddie Saxon up here to receive this acknowledgement.
Realize I was up to that. I was going to snap a picture there.
Right. Thank you. Good job. You want to say anything? Anything you want to share?
Well, I think it's definitely a great cause. I didn't know that I donated that much this year, but I'm glad I did, I guess. And yeah, I think Rotary Foundation does some great things, so I'm happy to contribute to that.
Love the green shirt too. I like it. I did hear if you're going to go look at a property on an island, you need to take a boat, right? You need to have a boat. That's just a funny story. Let's see here. We did have a Rotaract Club meeting. Is Sonia or Diane, anybody want to mention or share what we did there? Diane's on Zoom. Yep, Diane's got her hand up. Go ahead.
I would like to. It was fantastic, in my humble opinion. We had so much fun. Elliot Crowder, the winner of our 4-way speech contest, he was on the whole meeting. He got to interact, I guess he's the Interact president too, but he got to interact with the University of Oregon president and president-elect. It was just a fun meeting. And Richard, to that end, I would like to contribute to 3 People's Paul Harris Awards. I would like to contribute $25 to yours, $25 to Sonia's, and $25 to Rich Carter's for making this happen. You all are my Rotaract committee, so thank you so much.
Great job. You had a lot of preparation in that, so certainly appreciate that. So great job on that. David Adolph told me, he said that he's got some bags, and so he wanted to just mention quickly. David, stand up there and shout out if you like about what your bags are for.
So we have bags through Ball Drop, and it's for the scholarship fund that we have for the realtors of Lincoln County. And it's real easy to do. You take a blue bag and you fill up cans and bottles and take your bottle drop, or you can just call me or Freddie and we'll come pick them up. And then it puts funds in our account. And so it's great because then we get to give out scholarships for the realtors. And last year we gave out $10,000 and 5 different scholarships. Thank you.
Yes, wonderful job. Reminder, we got spring break coming up, so those cans will collect in the garage or out by the carport or whatever. So good space for them. Take 2 or 3 home and fill them up and do what you want to do there. So, all right. Any other quick announcements from anybody in the group here or on Zoom? Anything else going on we need to know about? Crickets. Okay. We have a historical minute, so John will cue that up, and so we get I think he's got it set up for a look back. So we've seen where Dick Fowler used to create that wonderful flyer, and it would, kind of commemorate the events, and we have a couple of things on there. So go ahead, John.
Yeah, so this is 10 years ago, March 15th. So 10 years ago, Mark Miranda introduced Rebecca Cohen as the guest speaker. And there was also talk about, remember when the Umpqua Bank had a fire? So there's mention of that the board meeting had to be moved because of the Umpqua Bank fire. And also the attendance rate. Jim, you'll like this. Pay attention. The net attendance was 65%.
We got that beat.
That's it.
Wonderful, and that's great, and I really appreciate those things, those look back, and it gives us, kind of fills in the gaps here. All right, any other happy bucks? I don't see Bob out here, I don't see Lowell out here, so any birthdays or celebrations, anniversaries you want to brag about?
Hey, Richard,
Got one on Zoom here, go ahead, who's that?
it's Doretta. I just want to make sure everybody has September 8th penciled in on their calendar for the annual Rotary barbecue that will be down at the Yacht Club.
Wonderful.
I don't know if I've missed a couple meetings, so don't know if you announced that or not, but we have reserved that, the Yacht Club for September 8th. It's a Thursday evening. More details to come.
Doretta, do you know the timing for that?
I think we typically have done it like about 5:30 till about 8:30.
I will put it on my calendar. Thanks.
You're welcome.
Wonderful. Any other on Zoom, any other announcements or happy bucks or anything there? I see some hands in the room here. Okay, Megan.
2 years ago today, I was in Ireland celebrating my mother's 80th birthday and St. Patrick's Day, where we couldn't go anywhere. There was no parade, there was no pub, no nothing. But we made it home on the 24th, and so I am $200 happy towards my Paul Harris for 2 years. And I'm back.
I see another hand or two out here. Sylvia.
$5 happy for this wonderful costume.
Major Raymond, that's a great job there. Never fails. Sonetta.
My granddaughter's turning 9 on Sunday, so I'm $9 happy about that.
Wonderful. With Bob being busy and other things, we miss him a little bit, and so one of the lists I had there a week or two ago was my own. I had a wedding anniversary, 29 years, March 6th. So I want to make sure and add $29 into the pot there. So, we're rounding out here. Oh, how about one more guy?
I have a question.
Certainly.
On the newsletter that was up there, what was the total number of members that you had that?
Good question. Take a look.
How about while he's looking that up, who's got a pin on? I'm going to buy a ticket for the thing there. So throw your hands up, Jim. I'll try to collect your hands there. Oh no, sir. One per person. One per. You got about 30 pins.
What about us on the Zoom too now?
On Zoom, how many hands up there? So it's going to be. Sorry, Jim.
67, guys.
And what do we have today? 76.
Keep your hands up if you want $1 for the.
Also, donate $1 to each. 76, 67, or 57. Somebody else do the math.
I sound like 9. All right, so we're going to have a wonderful program here. We're going to get an update for the American Pacific Hospitals. So let's welcome Ursula Marinelli up to introduce our speaker. Ursula.
I have to tell you that growing up, my dad told me that St. Patrick was Italian, and I believed it for many years. Anyway, okay. He had a whole story and everything. All right, so Dr. Ogden started with Samaritan Health Services in 2006 as an emergency medicine physician at Samaritan North Lincoln Hospital. In 2014, she became the Chief Operating Officer, and in 2015, she became their CEO. She did such a great job that Dr. Ogden was also named CEO at Samaritan Pacific Communities Hospital in 2017, and in order to create synergy in the services between the two Lincoln County hospitals. This past year, Dr. Ogden received her rural hospital CEO certification after completing a year-long program created by the National Rural Health Association to help her ensure stability in leadership in rural hospitals. Also this past year, the National Organization of State Offices of Rural Health selected Dr. Ogden as the recipient of the Community Star Award for Oregon, along with 49 other community stars, one for each state. Her story is published to inspire others who are working to improve the lives of rural Americans. Dr. Ogden was nominated for her exceptional leadership during the wildfires that threatened North Lincoln Hospital and impacted services at Pacific Communities, and for her hands-on approach to handling the ongoing pandemic, including active participation in community vaccination efforts. Dr. Ogden lives in Lincoln City with her husband, William, and her pet hermit crab, Fred. And I will now turn the floor over to Dr. Ogden.
I might have to explain away that hermit crab, right? But I really do have one. Well, I am so glad to be back with all of you and ready to share really what has happened. Oh my gosh, the last 2 years have gone by in a whirlwind, haven't they? And holy cow, I'm a little bit glad they're over, but I'll tell you what, not everything has been bad. So let's just review at least the past year. And then what I want to do is sort of go through that pretty quickly, because I want to tell you what's next and stop talking so much about the pandemic and start talking about whatever else we have going on, because it is a lot. So if we look at this agenda, that's what we'll do. We'll talk about the pandemic and then move on to updates. So let's dive right in to the pandemic. What you see on the graph there is a charting of the inpatients with COVID-19 in our hospitals starting in January of 2021 and ending in March of 2022. So the highest peak, which peaked out around 12, and that's out of 41 beds total. We had a total of 12 at our peak. That was back during the Delta surge. So that was in August and September of last year. You can see with Omicron, we still had a lot of action, but it was not as peaky. It was more stable. And of course, we peaked out about 8 patients in total of all of our 41. So we did not get overwhelmed. And I much attribute that to our vaccination rates within the county that are an astounding 86.6%. So. Okay, but let me tell you how this did affect us, because this very much affected us. And in fact, we started experiencing problems and issues back during the Delta surge that has continued to today. So you heard about the inpatients, but what happened there? Well, in addition to just having COVID patients in the hospital, we had some problems discharging patients, right? Because all of the problems and issues that we have had with the healthcare workforce, and over the past 2 years, by the way, 20% of the healthcare workforce nationwide has left for all their various reasons. Early retirements, can't deal with this, burned out, you know, whatever it is. We're down 20% of our workforce. So that has not only affected hospitals, it's affected long-term care facilities. So what has happened with our inpatient folks is that we are getting people who stay longer with us who do not need our services. They just can't be discharged to any long-term care facility. And I'm lumping that into everything from nursing homes to assisted living to, you know, whatever is different than your home, whatever institution, they're all affected. And that has not changed significantly. So some of the things that are happening within our hospital has not changed significantly either. We are experiencing transport delays like crazy. Also because our EMS partners have likewise experienced staffing problems and issues, and we're down at any one time, typically an ambulance or two for the county. So that has caused us to have problems getting patients transported between facilities, especially when they need a higher level of care. So sometimes we have been boarding patients in our ERs, and this is something we've never done. Like historically, this has just not ever been an issue. Another reason why we are boarding patients in our ERs and continue to do so, even though hospitalizations have gone down markedly around the state, and thank goodness, because we literally got really close to a breaking point twice now in both of the surges, where we just literally ran out of beds for hospital patients. But what we're seeing with those is, even though the hospitalization rate has gone down statewide, and some of those beds theoretically, you know, are starting to open for transports to higher level of care, we're not seeing that. There is just a really high utilization rate for hospital beds right now for all the non-COVID reasons you can think of. And a lot of it is delayed care, right? A lot of people just didn't want to get care in the past 2 years, and, you know, can you blame them? But a lot of it is catching up. It's surgeries that needed to be taken care of. It's chronic conditions that weren't addressed. So we are just super busy. I will never complain about that, because that makes sure we're vibrant and we're able to continue to do stuff, but it's not a perfect system anymore. Not that it ever was absolutely perfect, but it's really not perfect now, and things just aren't working in sync. So if you do have to be in the hospital, one of your loved ones does, just still try to be patient with us, because we are still trying to work out all the kinks, and we are hearing that it may well be another couple of years before we get any great relief from some of our staffing issues. So just so you're all aware, we're all in it together, from EMS all the way to long-term care facilities, and all experiencing the same sort of problems. I do want to just say really quickly, we are handling some of our problems though with daily bed huddles and more if we need it. We also did a lot of work with our COVID drive-through sites, and we are standing those up and taking those down as we need them for testing purposes. And then we've also had monoclonal antibody administration. So all of this is going on in that same milieu, and everybody's just doing a bang-up job. One of the reasons that I think we're also very successful in keeping COVID at bay, at least out of our hospitals, is we have a 96% vaccination rate for our employees at Samaritan hospitals. And so what you're seeing in that first set of bars that's right across the middle there is North Lincoln and PCH. There are two Lincoln County hospitals at 96% vaccination rates, leading the Samaritan system for that. So that is just amazing that all of our employees answered the call when we said, we need you to be vaccinated, we need you to protect yourself and our patients. And so another just kudos to all these folks who are working their behinds off. Okay, next one. And this is just a picture of some of those folks who worked extra hard last year when we asked them to not only do their job, but to go out and take on vaccinations, you know, across the county to help not only in our Samaritan vaccination clinics, but also in all of the county efforts as well. And these are just pictures on the left of some of the teams up at North Lincoln, but on the right, you see the very first vaccination that we had in our county. Dr. Scott Grupus took that vaccination. If you remember at the time, we were all like, what is this thing we're putting in our body? It turned out to be pretty darn fantastic, but he rolled up his sleeve first. And so we got that. And then that's Sarah Cole, who is, now call her our vaccine guru, because she put together all of our vaccination efforts there at Samaritan. And this is just cataloging in print how well we did as a county, our 86.6% vaccination rate. And that is just phenomenal, because when you look at everywhere else that has high rates like that, I think we were 4th in the state when I looked at those figures at the beginning of this month. And we're one of the only significantly rural counties. I mean, this is amazing, the things that we pulled out and made happen. So, so you can just be very, very proud of all of the efforts and all of the people who pitched in, volunteered, made magic happen. So on our next slide, let's go in and look at some of the other things that have been happening in the background and continue to happen, so you know what's ahead. So if we look at the first one there on the next slide, you'll see our walk-in and occupational medicine clinic that opened December 6th. So it was being built in the midst of all the kerfluffle. We finished the hospital just in time, but then we said, well, we got other things to do. So this was one of the first shows of having it finished. So this was the old Apple Peddler restaurant, if many of you remember that. And then it was the Patient Financial Services building. Then it was the Samaritan Medical Supplies building. And now it has a brand new label there as our expanded urgent care, and occupational medicine is there too. So if you're looking for either one, they're right there on the corner now, and better able to take care of everybody because they have expanded room and are able to expand the staff there too. So you see us just the pictures of us just doing a ribbon cutting there with the health district board members just immediately on the right side of that, and all the fantastic foundation and Samaritan staff and everybody else who made magic happen yet again. Okay, if we look at the next one, this is just a little blurb on our flooring situation. And you may have been aware that we have had some flooring failures of our brand new hospital. Tragic, I know, because it is such a beautiful hospital, but it has happened over a good 90+% of the 3-story portion of the hospital. Most of it is occurring on the 1st and 3rd floors, some of it on the 2nd floor as well. So we will need all of that flooring replaced. This will be a greater adventure than putting it in the first place, because we'll need to do it while the hospital is still running. But that's why we that's why we have our jobs, so we can figure this stuff out, right? And we'll be taking down little piece by little piece. We're not going to discontinue any service lines. We're just going to get it done when the time is right. Now, when will the time be right? When the money comes, because I want to assure everybody that this will not be coming from taxpayers. Taxpayer dollars, did pay for the hospital, as you well know. But this was a failure of those floors, and there was a failure at some point in either the installation or the product itself. So we will be bound to arbitration. We'll work through that process, and we're anticipating that will take the better part of this year. So we won't be engaging in the fix until 2023. And I say the fix, the permanent fix, because of course we're fixing those unsafe places and patching those as we go. So that's our flooring update. If you look at the next slide, we are still working on our preparedness efforts. And I think that the pandemic gave us a broader view of preparedness, right? Because we were really thinking Cascadia, and holy cow, infectious disease came out of left field and caught us with a pandemic. So we are even better prepared across the board, but we've got some things that we just need to get in place. The first one, of course, as you're very well aware as well, is our water situation. And so we all know that we could suffer a very small seismic event and lose water for the entire town. But in particular, for a hospital, we cannot operate without water. So we have to be there for our community. Therefore, we have to have some preparedness surrounding that. So we are working with the Pacific Community Health District, and we have come up in partnership with the city of Newport with an innovative solution to provide water storage that would be part of the city system until such time as an earthquake event happened. And then that would be a sole source water supply for the hospital, about a month's worth if we conserve. So we are super excited. That plan is up for FEMA look over. I don't know their process exactly, but they will evaluate the project, and we're hoping contribute funds because we certainly want their help with all of this as well. So lots going on there. Also within the building, fabulous building, of course, but then as you go through, you notice, wow, we're not really prepared for everything. And some of those things that we found out was our backup generator doesn't support HVAC systems in our lab and pharmacy. So, and of course, lab will go down if you don't have HVAC support. So rewiring, redoing, lighting systems on the second floor was another area. We typically do not provide emergency lighting for all of our clinic spaces, but in the middle of a building, you probably need that. So we're doing some work there just to make sure our building is resilient as possible. And of course, the health district is our big partner in all of the facility work that we do. Okay, let's look at what's happening in the north area. We've got a new MRI going in there. That is a 2,500 square foot addition to the current hospital, and it will be contiguous with the hospital. Everybody says, well, why didn't you just build it into the one you opened 2 years ago? Well, we had to continue to fundraise and really make sure that we had all the money to cover both projects, as you can imagine, but this one will be finished by the end of the summer. So excitement there as well. And then if we look at the next page, you may recognize the Center for Health Education on the left there, and the modular walk-in clinic building that served us through the whole time we were building the hospital here. Well, it did not go away to the dump. It had a new life, and we have moved it up to North Lincoln to the Lincoln City Medical Center. That is becoming an extension of the rural health clinic there, and will allow further extension of primary care in the north end of the county. So we'll be able to stick 3 or 4 more providers in that rural health clinic and handle all of the needs there. So what a fantastic way for it to serve everyone along the coast. And then as we look at different service lines, what are we doing now that we're coming out of this pandemic, and how can we get restarted with some vigor? Well, endocrinology is coming back. You may remember, as I do, way back when we had our own endocrinologist practicing out of Depot Bay Clinic. And so, of course, he retired, and it's just been hit or miss since. And of course, for those who have brittle diabetes and so many other types of endocrine disease states, we need this expertise. So we have already brought it back here in Newport, but it's coming soon to the north part as well. And in fact, I believe they already had their first clinic in March. We have a new specialist in palliative care who we have put through school, and that is Teresa Curran. If you are aware of her, she's a primary care provider up in the north area, but she has her new specialty of palliative care and has started seeing patients 2 days a week in that area. So we're happy to have that in our county, and she's addressing those needs. Infectious disease, as you can imagine, has been very busy over the past 2 years. So they have not been able to come out to Newport as expected. They are back at it though. And they feel like, well, we got this as best under control as we can. So now they are visiting us again. And you might say, well, what else do they do other than COVID? Boy, they do everything that is a real pickle to figure out that's any sort of infectious disease. So everything from HIV to just really even ordinary types of infections that are just persistent. So it's just lovely to have them. Hematology and oncology, unfortunately, with our population, we have a high need there. And we have had some turnover that we didn't quite like within the hematology oncology area. And so we affiliated with Oregon Oncology Specialists out of Salem. And you may know Dr. Bud Pierce by his running for governor. He is the medical director of said OOS, and he handles the patients up in Lincoln City. But no matter how much I tried to persuade him, I could not get him to cover Newport fully as well. But we have had some expansion there. We have actually our own 2 different providers who are now covering Newport permanently from his group, and then he fills in when they cannot. So had a lot of expansion there, a lot of stabilization, and very, very happy that that group is working with us. And then last but not least, nephrology. We have always had nephrology services for years and years and continue to do so, but our dialysis partner, Fresenius, decided not to renew contracts in Corvallis and Newport. So we affiliated with DaVita instead. That was a little bit traumatic as they switched out because DaVita wanted to redo all the equipment and bring it up to date and make sure it was brand new in our dialysis facility here. So all of our dialysis patients for two or 3 months had to go up to Lincoln City to get their dialysis, and that is just not a fun drive. But they did it. They're back into their updated unit, and we've got new facilities for all our folks in Newport now. So kudos to all of that. In hospital service lines, we are doing a PET CT expansion. And you say, what is PET CT? It's that imaging that we need, especially for our oncology patients to stage cancer. And if you've seen it, it's sort of like a heat map where cancer lights up. And so this is used in almost every different type of cancer to stage initial cancer diagnosis and then to track treatment. So it's used multiple times during treatment. So we want to make those types of imaging very convenient for patients. Right now, you can get that done at North Lincoln, but we find that most of the Newport people actually trek all the way over to Corvallis. So we're going to set up services here, so that doesn't have to happen. And then we'll expand services in both locations, Newport and Lincoln City, and make it so that everybody can get their services right here at the closest home to them. We do have oral health services now as well in North Lincoln and soon at PCH. That's a little bit weird to have dental hygienists working with us in our hospitals, but we love it. And we're happy to pilot that. And we've done some surgery expansion. If you look at the next slide, we increased last year about 15% in Newport, expansion of surgical services, and about 13% at North Lincoln. We have growth predicted this year to continue that at about, we're going to say about 5%. We're not going to say we're going to do as big as we did last year because we certainly know that we have contained growth. One of the things that we'll continue to do as well is improve our services, and we have a lot of agenda items surrounding that. If you look at the next slide, and we're almost there, these are just a list of a variety of things that we're working on, and I'll just highlight a few because I'm running out of time here. But the Family Medicine Rural Training Track is a grow your own family medicine doctor program that we have been grant funded by the federal and state governments for. And we have our first class that will be starting with us this summer. And we just got word that 3 people matched in that program. We only had 3 slots and 3 slots were filled. That is outstanding for a first-year program. Many do not fill, even in some urban areas. So we are excited about that. And in 3 years, we will graduate those 3 doctors in the specialty area of family medicine. And remember, they're doctors when they start with us, but they will be studying family medicine and spending the last 2 years of their work with us here on the coast. So super exciting. We're on a big journey to become a highly reliable organization. And if you question what that is what we've seen in the nuclear industry and the airline industry to reduce, in the airline situation, reduce crashes. Remember when crashes were a thing and you actually had to think about getting on an airplane because it was statistically possible you might go down? And now it's not even a worry. We want to do the same thing with patient harm and medical errors in the hospital setting. And this is a huge multi-year rest of our life journey, but we're going to bite this off and take it. Our Coastal Stars program, you've probably heard some rumors that we need a treatment and recovery facility here in Lincoln County. Our problem is not getting better, it is only getting worse. Especially throughout the pandemic, and we have a solution in partnership with the Pacific Communities Health District, who has now purchased the property where that will be, and on Northwest Biggs around the lighthouse. We will be running that, but we will be in partnership with many, many people to make that happen over the next couple of years. So it is becoming a reality, and we are super excited. We've got so many other things we're working on. But I will stop there because you probably might have a question or two. And I think Ursula went over a lot of the awards that we've won the last year. But I'll tell you what, they just keep coming. And I just have to attribute that to the amazing medical community that we have along the coast. So thank you so much.
Any comments?
I threw a lot at you really fast.
All right, well, thanks for the update.
The things that Dr. Ogden is that we do is fight polio, as you know, as a visiting Rotary. So in your name, we're going to cover the cost to vaccinate 50 children for that effort. So certainly. All right, how about Secretary's report? We'll have Jim up the lectern. Jim.
Thank you, President Richard. And so Sonia's going to have the big wheel after I'm done blabbering, so she'll be right here. Organically, our attendance today is 30 out of 63 for 47.6%. After applying makeups, however, we come in at a whopping 65.1%, 41 out of 63 members on hand and present or present in spirit. And member incentive is Paul Skydema. You know, Paul's been winning a lot lately, so it's maybe appropriate that he's not here today, so that'll roll over and be $10, not just 5, but 10. Count them $10 membership incentive next week. And with that, I'm going to turn it over to Sonia for the 50-50 raffle.
All right, well, thank you. Well, this is amazing. We have $171 total, so that means that the big wheel winner will win $85.50. Let's see who that's going to be today. A little delay there, huh? I get to know before you. Patty Eisler.
You have a standing order?
She has a standing order, so she's got it.
Great job. Thanks, Sonia.
Again, that's just another shout out. You don't have to be here to win. You can have a few bucks in and then win a nice prize. We love that it's getting elevated to be a whole lot worth a whole lot more. I asked John earlier, but do we have a social media award this week?
We do, and a couple things, greeters
it takes two people to run the front. So David is next week, and he's all by himself. So does anybody volunteer to help Dave next week? Thank you. We'll take that. And then I'm going to send out the greeting list again because it was made for Zoom, which is one person. We need 2 people per day because it's a zoo up there. So I'll send that out this week. And this week's winner is beautiful Megan Shane.
Yes. And so again, we heard Doretta say earlier that mark your calendar September 8th evening. And in the past, we've done a barbecue and it'll be a light thing at the yacht club down on the bayfront here. So make sure and mark that. And then we also have a program coming up here. It's kind of a field trip, but April 14th will be, and I think is it, Diane, is it at the Gladys Valley building? Is that where it's actually at, in Hatfield?
Yes, sir. It is at the Gladys Valley building. Do you want me to talk a little bit more about that?
Sure, share just a minute, if you will.
John and Doretta have been working hard on it. They went yesterday to the Gladys Valley building and made sure everything was set up correctly. Ultralife will be providing lunch, and we'll have, I'm holding up my hands, little sheets to fill out to say what kind of a sandwich you want, et cetera, et cetera. So everybody is really working hard on making this happen, and it should be a lot of fun. It's Dr. Sarah Henkel and another professor, I can't remember his name. Her boss.
Helen. Last name's Helen.
Thank you, Doretta. And they will be talking about PackWave and a whole bunch of other stuff. So it should be really a lot of fun.
Just a couple of comments about that. The lunches will have to be pre-ordered, so please be paying attention to your email about a week ahead. And the other thing is that John, I'm sure, would chime in. It's really a nice facility. So looking forward to seeing everybody there.
Thank you guys for that report there. That's certainly interesting. It's kind of a little different. We're going to venture out being in a little different facility. So looking forward to that. All right, let's see. Next week, we're going to have a spotlight. It's going to be a seasoned member spotlight. So it'll be our own Sonia Graham. She's going to talk about the 60+ Center. So make sure and show up for that. And then again, if you're not feeling well with the in-person hybrid, please, use Zoom, use the hybrid option to participate. And so we want to be safe, and especially when we've got our main hospital CEO right here, we want to do good things in front of ourselves. Great job there. All right. Now we had Marisa. Marisa, did you have help on greeting today? Do you want somebody else? Was there a partner that you ended up with?
I did not have help.
Okay. Well, I was gonna give you a break and let them do that. But okay, will you take us out with the 5-way test then?
Okay. The 5-way test. Is it true? Second. Is it fair to all concerned? Third, will it build goodwill and better friendships? Fourth, will it be beneficial to all concerned? And fifth, is it fun?
See you all next week.